Hello, today we're going to be talking about heroin. What is it? What is heroin? Well, heroin is an opioid drug made from morphine, a natural substance taken from the seed pod of the various opium poppy plants grown in Southeast Asia, Southwest Asia, Mexico, Colombia, and other places. Heroin can be a white or brown powder or a black sticky substance known as black tar heroin. Other common names for heroin that you might hear on TV or on the street include Big H, horse, hell dust, and smack. Now, how do people use it? How do people use heroin? People inject it, they sniff it, they snort it, or they smoke heroin. Some people mix heroin with crack cocaine, which is a practice called speedballing, and is extremely dangerous. Killed some individuals like John Belushi. He's a famous guy, right? Maybe someone in the area. Now, what effects of heroin? Heroin enters the brain rapidly and binds to opioid receptors on cells located in many areas, especially those involved in feelings of pain and pleasure and in controlling heart rate, sleeping, breathing. Prescription opioids and heroin, there's a relationship between them today that did not exist about 25 years ago. Prescription opioid pain medicines such as OxyContin and Vicodin have effects similar to heroin. Research suggests that misuse of these drugs may open the door to heroin use. Nearly 80% of Americans using heroin, including those in treatment, reported misusing prescription opioids first. While prescription opioid misuse is a risk factor for starting heroin use, only a small fraction of people who misuse pain relievers switch to heroin. According to a national survey, less than 4% of people who had misused prescription pain medicine started using heroin within 5 years. Now, this suggests that prescription opioid misuse is just one factor leading to heroin use. But of course, we've got to pay attention to it. You can read more about that in this intertwined problem in the information down below this site. Okay, we've got some information coming to you from NIDA, directly from NIDA. I'm reading it from the website, and you can see it yourself with the link that's going to be down below. If you want to hear me talk about it, here we go. I'll tell it to you, and you can read it later. Short-term effects from using heroin include people who use heroin report feeling a rush, a surge of pleasure or euphoria. However, there are other common effects including dry mouth, warm flushing of the skin, heavy feeling in the arms and legs, nausea, vomiting, severe itching, clouded mental functioning, going on the nod, which is a back and forth state of being conscious and semi-conscious. That's dangerous. Now, long-term effects can include that people who use heroin over the long term may develop insomnia, collapsed veins for people who inject the drug, damaged tissue inside the nose for people who sniff or snort it, infection of the heart lining and valves, abscesses, which is swollen tissue filled with pus, constipation and stomach cramping, liver and kidney disease, lung complications including pneumonia, mental disorders such as depression and antisocial personality disorder, sexual dysfunctions for men, irregular menstrual cycles for women. Other potential effects include heroin can contain additives such as sugar, starch, or powdered milk. They fill it out, so you buy you think you're buying more, but you're not. It can clog the blood vessels, leading to the lungs, liver, kidneys, or brain, causing permanent damage. And also, sharing drug injection equipment and having impaired judgment from drug use can increase the risk of contracting infectious diseases such as HIV, AIDS, and hepatitis. And we've got more information here on this channel and at NIDA and other locations about injection drug use, HIV, and hepatitis. Now, I'm going to mention something about that real quick here. People who inject drugs such as heroin are at high risk of contracting the HIV and hepatitis C virus. These diseases are transmitted through contact with blood or other bodily fluids, which can occur when sharing needles or other injection drug use equipment. HCV is the most common blood-borne infection in the United States. HIV, and less often hepatitis C virus, HCV, can also be contracted during unprotected sex, which drug use makes more likely. Again, you can read more about that in the link below. Okay, now can a person overdose on heroin? Here's a big question for you. Can they? Yes. A person can overdose on heroin. They can take too much. They can get too much. It can go in their body and affect it negatively. A heroin overdose occurs when a person uses enough of the drug to produce a life-threatening reaction or death. Heroin overdoses have increased in recent years. When people overdose on heroin, their breathing often slows or stops. This can decrease the amount of oxygen that reaches the brain and is a condition called hypoxia. Hypoxia can have short and long-term mental effects and effects on the nervous system, including coma and permanent brain damage. Now, how can a heroin overdose be treated? Naloxone is a medicine that can treat an opioid overdose when given right away. It works by rapidly binding to opioid receptors and blocking the effects of heroin and other opioid drugs. Sometimes more than one dose may be needed to help a person start breathing again, which is why it's important to get the person to an emergency department or a doctor to receive additional support if needed. Now, there's more information down on the bottom. I'm going to tell you something else about naloxone. You can give them the two things and get them started breathing again, but because the opioids may last longer than the effects of the naloxone, they may slip back into overdose within 25 to 30 minutes. So getting them to the hospital is very important. Even if they don't want to go, gotta get them there. Now, naloxone is available as an injectable needle solution or a handheld auto injector and a nasal spray. So it's called a Vizio and Narcan. You can find these things at the drug stores, or you can order them. Friends, family, and others in the community can use the auto injector and nasal spray versions of naloxone to help save someone who is overdosing. The rising number of opioid overdose deaths has led to an increase in public health efforts to make the naloxone available to at-risk persons and their families. So if you know somebody, even if they're taking an opioid or something that's prescribed for them, having this stuff around is a good idea. All right. Now, some states have passed laws that allow pharmacists to dispense naloxone without a prescription from a person's personal doctor. And you can read more about that on the naloxone webpage right down below. Now, is heroin addictive? Is it? Heroin is highly addictive. People who regularly use heroin often develop a tolerance, which means that they need higher and more frequent doses of the drug to get the desired effect. A substance abuse disorder, referred to as SUD, is when continued use of the drug causes issues such as health problems, failure to meet responsibilities at work, school, or home. An SUD can range from mild to severe, the most severe form being addiction. Those who are addicted to heroin and stop using the drug abruptly may have severe withdrawal. Withdrawal symptoms, which can begin as early as a few hours after the drug was last taken, include restlessness, severe muscle and bone pain, sleep problems, diarrhea, vomiting, cold flashes with goosebumps. Oh, call it cold turkey. Uncontrollable leg movements, kicking the habit. Do you know this stuff? I thought they were just phrases. And severe heroin cravings. Researchers are studying the long-term effects of opioid addiction on the brain. Studies have shown some loss of the brain's white matter associated with heroin use, which may affect decision-making, behavior control, and responses to stressful situations. So they become very much a part of each other's lives when we have someone with a problem like that, right? Got to watch out. How is heroin addiction treated? Now, a range of treatments, including medicines and behavioral therapies, are effective in helping people stop heroin use. It's important to match the best treatment approach to meet the particular needs of each individual patient because it's all individual. Medicines include buprenorphine and methadone. They work by binding to the same opioid receptors in the brain as heroin, but more weakly, reducing cravings and withdrawal symptoms. Another treatment is naltrexone, which blocks opioid receptors and prevents opioid drugs from having an effect at all. A NIDA study found that once treatment is initiated, both a buprenorphine naloxone combination and an extended-release naltrexone formulation are similarly effective in addiction. Because full detoxification is necessary for treatment with naloxone, initiating treatment among active users was difficult, but once the detoxification was complete, that means staying away from the drug and getting off it for a while, a few days. Both medications had similar effectiveness. Now, behavioral therapies for a heroin addiction include methods called cognitive behavioral therapy and contingency management, learning how to live again without the stuff and without that society there. Cognitive behavioral therapy helps modify the patient's drug use expectations and behaviors and helps effectively manage triggers, they're called triggers, and stress that get a person into the same situation. You got to get a new situation going on, you know. Go to the supermarket. Don't go to buy the drugs. Go get yourself some oranges. Don't get the heroin. That's its oversimplification. Now, contingency management provides motivational incentives such as vouchers, small cash rewards for positive behaviors, such as staying drug-free, right? You can get a job, and then that's what's going on in the world, right? These behavioral treatment approaches are especially effective when used along with medicines. Now, you can read more about all this down below in the link down below. Now, I'm going to talk about points to remember, then we're going to wrap this one up. And you got the link down below. You can link on it. You can read all about it yourself. Yep. Share it. Share it. Now, points to remember from this, where heroin is an opioid drug made from morphine, which is a natural substance taken from the seed pod of various opium poppy plants. Heroin can be white or brown powder. It can be a black sticky substance known as black tar heroin. People will inject it, sniff it, snort it, smoke it. Some people mix heroin and crack cocaine, called speedballing. Very dangerous stuff. Heroin enters the brain rapidly and binds the opioid receptors on cells located in many areas, especially those involved in feelings of pain and pleasure and in controlling heart rate, sleeping, and breathing. People who use heroin report feeling a rush or euphoria. Both other common effects include dry mouth, heavy feelings in the arms and legs, and clouded mental functioning. Long-term effects may include collapsed veins, infection of the heart lining and valves, abscesses, and lung complications. Research suggests that misuse of prescription opioid pain medicine is a risk factor for starting heroin use, so keep an eye on it. Anybody in your family, any of your friends, watch it yourself. Read down below. It's important. Don't want you to be in pain. Don't want you to get in trouble. A person can overdose on heroin. Naloxone is a medicine that can treat a heroin overdose when given right away, though more than one dose may be needed. You can get it at the pharmacy. Talk to your doctor if you can't get it at the pharmacy. If you need one for your family member, whether they're addicted, whether they're at risk, or whether they're taking some opioids to relieve pain. Now, heroin can lead to addiction in the form of substance abuse disorder, and withdrawal symptoms include severe muscle and bone pain, sleep problems, diarrhea, vomiting, and severe heroin cravings for the item. A range of treatments include medicines and behavioral therapies. They're effective in helping people stop heroin use. They can't stop it. You can't stop it. It can be stopped. You can deal without it. You can get rid of it. You can stop it. It can happen. It happens. I see it all the time. Friends did it. You can do it if you need to. Your friends can do it. Your family can do it. All right. Treatment plans should be individualized to meet the needs of the patient. It's all about you. It's all about the individual. It's all about your family members. It's all about your friends. And you may not be happy with them right now. But if you can help them, go ahead and do it. Look down below. Read the stuff. Had a great time talking to you. Have a pleasant evening. Be well. Be healthy. Be happy.